All right, I'm going to go ahead and get us started. Thank you all for joining us for Healing-Centered Engagement for Intimate Partner Violence Training with Rebecca Levinson. The Maternal Health Learning and Innovation Center is hosting this training, so I'm going to give a very brief overview of the Maternal Health Learning and Innovation Center for those of you that have never interacted with us before. Rebecca, if you wouldn't mind going to the next slide. Thanks. So this project is supported by HRSA and the U.S. Department of Health and Human Services. So we would like to thank them for their financial support. Next slide, please. The mission of the Maternal Health Learning and Innovation Center is to foster collaboration and learning among diverse stakeholders to accelerate evidence-informed interventions, advancing equitable maternal health outcomes through engagement, innovation, and policy. Next slide, please. The center's central goal is to provide a continuum of learning opportunities that enhance the capacity of all maternal health practitioners across the country. Established in November 2019, MHLIC aims to advance federal and state level efforts to eliminate preventable maternal deaths and reduce severe maternal morbidity, including equity, as the cornerstone of all services. The MHLIC provides resources and capacity building assistance in 3 specific areas: maternal health policy, community and provider engagement, and maternal health innovations. We actively work to center anti-racist principles and continuous intercultural development. Next slide, thanks. Our team includes maternal health, policy, innovation, engagement, and implementation experts from the American College of Obstetrics and Gynecologists, the Association of Maternal and Child Health Programs, Georgia Health Policy Center, Race for Equity, Reaching Our Sisters Everywhere, and the UNC Gillings School of Global Public Health, the Jordan Institute for Families at UNC School of Social Work, and the UNC School of Medicine. Next slide, please. You can visit our website at maternalhealthlearning.org to learn more, explore our National Resource Center, and sign up for our newsletter to stay informed about upcoming events. And you can connect with us on the socials and subscribe to our quarterly newsletter and e-blasts, which have lots of great information in them. And once this training, for those that are unable to join us live, once this training is posted in our resource center, that will also go out in our quarterly newsletter. So a little bit of extra incentive to sign up for that newsletter. And now I am going to turn it over to Rebecca Levinson, who will be leading this training today. Rebecca has decades of experience helping healthcare systems respond to intimate partner violence. A former Planned Parenthood clinic director and domestic violence policy analyst for the national nonprofit Futures Without Violence, Rebecca is a nationally recognized researcher, educator, advocate, and speaker. Rebecca is the architect of the Futures Evidence-Based Intervention, CUES, which applies the power of universal education and altruism to improve providers' ability to help clients experiencing IPV. Ms. Levinson is an author of numerous additional IPV training resources and publications. So thank you so much for joining us today, Rebecca.
Thank you. And I'm so excited to be here with all of you. So it was a pleasure watching the chat blow up and get a sense of how big our country is. So we saw folks from the South, we saw folks from Minnesota, where I was born. We
muted yourself.
Am I unmuted now? Great. So anyway, it's a pleasure to be here. And I want to just acknowledge a couple things up front. Today, I had hoped to be joined by my wonderful colleague, Virginia du Plessis, who is the other brain partner trust person in this big shift in the way that we've been doing our work around maternal health over the last couple decades. So she's very sorry to not be with us today. She's a certified doula She loves maternal health. She's been doing lots and lots of innovative work around the country, but she just unfortunately couldn't be here today. I also want to shout out 2 other institutions that we've partnered with on creating this new curriculum. So you are one of the first in the whole country who is getting to see a baby that's been percolating for a couple of years now. So I'm pretty excited about it. I want to especially thank Linda Gilkerson at the Erickson Institute for allowing us to use her model called the FAN. And we'll be talking about that both today and tomorrow. And then I also want to deeply thank our friends at Washington State Coalition on Domestic Violence. They've been doing some of the national leading work around partnering with home visitation and maternal health programs for a very long time. So you're getting a lot of brain power in what I'll be sharing with you today. To give you a little sense about who Futures Without Violence is, so this is the company that I was a senior policy analyst for, but am now a consultant for. We're the U.S. Department of Health and Human Services National Resource Center on Health and Domestic Violence for the whole country. So essentially that means we're supposed to knock on your door and say, what are you struggling with your families, with your clients around intimate partner violence, and how can we help you, right? So we bring sort of research, best practices on the ground, policy thinking, and sort of pull it all together alongside our advocacy friends to create these kinds of tools for you. Almost everything we create is free for the field. Sometimes you have to pay postage. So a lot of what I'm going to be referencing today is things you can download and things that we'll send you. So I just want to get a little read on the room. I think it's always good to get a sense of sort of, you know, what brings you here. So I would love for you to answer in the chat box. What does working in maternal health mean to you? What does working in maternal health mean to you? I think it's nice for us to kind of all go back to the start and think a little bit about why we do this work and maybe even celebrate together. Why? What does it mean to you to work in maternal health? And you can share in the chat. For optimal parent functioning. Thank you, Magdalena. Anybody else? What does it mean to you? Family empowerment, positive outcomes, supporting moms and babies, best starts for everyone, feeling supported, health equity, impacting outcomes that affect our families. Beautiful. And I'm curious, so this is all about our families. Eliminating disparities means partnering. And I want to know what it means to you too, personally. What does it feel like to you? Changing cycles for families, encouraging best practices, help saves lives. Safe and healthy families, strong and healthy communities. I love this group. Righting wrongs, very powerful. Prioritizing moms and women's, not just infant and children. Breaking harmful cycles, support and encourage. Supporting families. And you know what I hear in all of this, right? I hear your passion. I think that working in maternal health is some of the most powerful work there is. And I'm here to celebrate you and what you do and hopefully give you additional supports and tools to do the really important work you described in the chat just now, your goals for maternal health. So I want to just give you kind of an overall sense of our journey, right? We've got 2 days together. So as a result of what we're going to learn today, we're going to understand how violence and trauma impact you, right? Individual staff folks, how it impacts well-being, and then strategies toward developing systems of wholeness and healing. And when I talk about this, I think sometimes the onus of self-care is put on the individual, and I'm really here to also talk about system change because we know that's really needed. We're going to prioritize staff well-being as a core component of addressing domestic violence, intimate partner violence, adverse childhood experiences, trauma broadly. And I don't think there's a one of us in this room together today that doesn't have a story about how someone's sharing a story of their own about harm, where they were harmed, their kids were harmed, that there was something really, really hard in their families, that it didn't impact you directly. And so today is really about recognizing that if we're going to be doing the best work with families, that means taking care of all of you first and helping when you have that moment of overwhelm, because none of us are exempt from having those kinds of moments of overwhelm. And if you haven't been trained on the FAN, which stands for Facilitated Attuned Interactions, don't worry, I'm going to give you a little taste of the FAN with the permission of my friend Linda Wilkerson, because I think it's a model that once you kind of learn it, you feel like you always have a friend with you. You've always got a way of handling it when something comes up that you weren't expecting, which I think is a real gift. And I wish I would have had that, 30 years ago when I started doing my work. So I'm excited about that too. So today we're going to be really focusing on you and system change and sort of how organizations can really make a difference. Tomorrow, we're going to be shifting over to, now that we've learned to take care of ourselves really well, let's talk about ACEs. Let's talk about a framework called HOPE, ways in which we can really shift our national thinking away from what's wrong with families to what's the best about families. So strength-based approaches to all of our work. We're going to learn that cues intervention. So we're going to learn about why universal education is so helpful and important, both when it comes to adverse childhood experiences and intimate partner violence. And then we're going to see how to use that FAN model and apply it in some really sticky situations. And so we'll give you case studies, case scenarios, ways to think about applying all the things that you've learned and give you a chance to problem solve and, have an opportunity to really experience using some of these tools in person. All right, so today, let me just give you the overview of specifically today. So there's 2 modules we're going to cover: cultivating organizational staff and well-being, and then we're going to have a 10-minute break. And then module 2 is understanding the FAN and how to apply that to disclosures. Don't feel like you need to take copious notes, or if I go too fast, you're not going to be able to write down the link to the thing that I just talked about. Kelsey's going to drop in the chat right now a list of all of the resources for both today and tomorrow. So you don't have to worry about taking pictures or taking notes. The other thing I want to mention to you is this is being recorded. So if you want to go back and have an opportunity to kind of rethink some of these pieces again, you'll have that opportunity as well. All right, so let's talk about cultivating organizational practices and staff well-being. So I want to start with just a collective moment to be still together. I don't know what was happening today in Des Moines or in Kentucky or in Portland or in Minnesota or in Indiana or in St. Louis. But chances are maybe you were rushing from one thing to this, or maybe you just had a hard call with the family and you're walking into this space. And part of what we know helps prevent burnout and helps take care of staff is when we can take little moments to center ourselves before we move on to the next thing. So I'm just going to ask you, and you can do this in any way you want to. You can close your eyes. You can go to your favorite go-to sort of catching your breath moment, but I'm just going to ask that we all just take a second. Try to clear your mind. Get a little bit still. Maybe take a deep breath in. And let it go. You rub your shoulders back. Get comfortable in your chair. And one more deep breath. So I appreciate you taking a second and just getting an opportunity to get your feet back on the ground for the training today. So part of what I love about working in maternal health is that I have learned over the years that one of the things historically trainers and systems have done to individual workers is we typically jump over you and we say, let's teach you how to work with those people over here, versus, hi, your name is Mary, your name is Donna, your name is Heather, your name is Kelsey. How are you doing today? And shifting it and actually modeling what I know you do with your families or your moms all the time, your birthing patients all the time, but just give a chance to sort of acknowledge all the folks in the room. There are 156 of you. I would love to hear what sums it up for you today. How are you feeling? I wish we were in person. I wish I could see your body language and your expressions, but the best I can do is chat. So I'd love to hear, how are you today? Grateful, tired, overwhelmed, exhausted. Fair, Sandra. Thankful, hopeful, tired but blessed, tired but fabulous, exhausted and overwhelmed, rushed, present. Nice, Nikisha. Concerned, tender, had a great weekend, blessed. Getting some relief from the horrible heat. Mary, I've been thinking about all of you who are in hot places right now. Grateful, anxious, content, blessed, and hopeful. Well, my hope today is that what you're going to leave here with is a sense of, if you're feeling tired and exhausted, a sense of feeling supported, a sense of feeling like somebody really cares about you, a sense of rejuvenation, a sense of what's possible. For my friends that are already feeling grateful and hopeful, I think this is going to make your cup even more full because you deserve it, right? This is about taking a minute to notice, what do staff deserve in order to be able to do this important work? And why does this matter so much? Well, COVID was really hard for all of us, right? So I know there are folks on this phone who lost family. I know that there are folks maybe who have people in their lives who are sick right now. I know that there are folks who maybe had a partner lose a job. My husband lost his job in COVID. I know that there are folks who had to maybe move or maybe lost a house. I know that all the things that might be happening to the clients you serve may have touched you or someone you love or someone in your own family. And one of the other pieces to COVID is that we know it increased domestic violence. And with that increase of domestic violence, each one of you, because you are caregivers, helpers, professionals who are working to have the best outcomes, we know that your burden got bigger. And I can tell you, when everything shifted to Zoom, part of what we saw, and I know I have domestic violence advocates friends on this phone, so I'm sure this is going to sound really familiar because a lot of you shared this with me. This is pieces from the National Domestic Violence Hotline, but isolation in COVID was this really powerful tool because all of a sudden we weren't allowed to leave our houses. So partners could, take our phones and maybe monitor who we texted and who we called. So we know for some of you doing case management, home visitation, Zoom clinical calls, you might have been the only person that mom or that birthing person was allowed to talk to, right? So you might have been the first responder for families. You might have been the only other contact with them. You might be the only kind word heard. And we're going to talk about the power of words today, not only for each other with our colleagues, but also the power of it with clients. And I'm going to hopefully give you some new ideas to incorporate in the ways that you're doing your case management that we've seen made a big difference and in a lot of circumstances nationally. You might be the only access to help and information. One of the amazing things that, I've worked in every single state in the whole country with home visitors and perinatal case managers. When I worked at Planned Parenthood, we ran a very large perinatal case management program here in California, CPSP. And so I love this work. I've been doing it for a very long time. And one of the opportunities I get as a national trainer is I get to hear the innovation that's happening. So when I was doing training after training on Zoom, I was asking people, so what cool things are you doing to connect with families since you can't hug that chunky toddler or hug that baby or see, what's actually happening in real time because you're on Zoom? And so one of the things that one of the home visitors shared with me is that she was somebody who loved to go to yard sales, and she loved to get like all those old vintage cards or postcards that people would have in the back, and you could get like 20 for a nickel or whatever. And so she's somebody who kind of picked all those up over the years. And one of the things that she decided to do to create more heart and connection with her families is that she handwrote notes saying, hey, thinking of you, wanted to say you're a great mom, wanted to say, you're doing such a good job. I'm so proud of you, right? And the response to just that stamp and that little note that was jotted, the home visitor couldn't believe how amazing the responses were. Her phone was blowing up. Oh my God, that was the sweetest thing that ever happened. Thank you so much. So then another home visitor hears this story, and she's missing her chunkalunka toddlers. And so she decides toddlers deserve mail too, which I love that. So she got envelopes and she got sticky tape that was sparkly and had emojis on it. And it was very clearly like kid-centric. And so she would send that to the toddler, right? And this is special mail for that 3-year-old or whatever. And so then they could open that together, or mom could bring it back out and have the child look at it with the home visitor. So that was another cool thing. I think another thing that we saw was, we know that crossing the midline when you get hugged or when you do it to yourself, we know that can help calm you and soothe you. And so part of what we were wanting to do is help families with that crossing the midline, but in a way that felt authentic through Zoom. So one of the things home visitors did was they dropped off a bag of things, which might have included a bear or a lovey of some sort, a puppy or whatever, and they had the matching one at their house. And so they could start their visits with a hug, even though they couldn't see each other, which I thought was really darling. I also think that one of the things that we learned about Zoom that was really beneficial is because you can turn off your camera, and because it doesn't matter, like this is where I think this kind of, maternal health exchange is so powerful, because let's say in St. Louis, we have a really gifted case manager who's really good at talking about maternal depression, for example. Wouldn't it be amazing if I'm a newbie and I'm looking for expertise in that, but I live in Flint, Michigan? And could we have a consortium where looking for someone I can shadow who's really good at this person, who's good at this says, oh yeah, come on down, I'll introduce you, and then you can just turn off your camera and kind of watch how the visit works. One of the things that we learned in COVID is that Zoom actually allowed for people to have a more comfortable experience in some cases, observing, because they didn't have to worry about, should I talk, should I not talk, how do I engage? They could just disappear and really watch the authentic conversation unfold. So I'm also going to give that to you. So I want to hear from you. What about you? What are you keeping from COVID? What innovations are you excited about? We've got like 161 people on this call. There's a lot of expertise in this room. So I want to know, is there anything you want to share that you did in COVID? And you're welcome again to do this in chat. Or if anybody, one or two of you, I can't let everybody go, but if anybody wants to share something cool that they did in COVID or that they're holding on to, we'd love to hear. We're still doing strong virtual groups. Bernice, that's awesome. And Zoom maybe is allowing that to happen. 80% Zoom therapy with clients. Magdalena, thank you. Some adapting to the virtual space, doing presentations, videos. So there's this funny mixed bag, right? There's a lot to be said for in-person, but there's actually a lot to be said for Zoom. One of the other things I've heard from home visitors or case managers is, sometimes teens can be tricky, right? So they maybe don't always make their appointments, or their schedules are changing, all the things, right? And so having that flexibility on Zoom made a difference. Set up places around town that clients can experience outreach, support Zoom groups via Zoom, making it more accessible. I love it. That's awesome. All right, so if you have other ideas you want to pipe into the chat as we go on, that would be great too. So one of the things that we've been thinking a lot about is this idea of trauma-informed care. And I'm sure many of you have had a fair bit of training on this concept, maybe really deep training on this concept. And given all of the trauma that's come with COVID, and really thinking about what do we want for families? What do we want for staff? Which is this big idea of healing-centered engagement. I want the whole thing. I want wholeness, love, needs being met, conversations being as rich and real as possible. I want historical harms to begin to be righted in meaningful ways. And so as we were thinking about trauma-informed care, we came across another thinker, researcher, and his name is a man called Dr. Sean Ginwright, and he's out of California. And I think that he and his thinking about where do we want to go was so inspiring to so many of us. I wanted to share it with you today. His thinking is trauma-informed care is important, but maybe it's not complete, right? Maybe it fails to address the root causes of trauma that exist in the environment, right? Not just in the individual. It focuses on coping with symptoms rather than healing from them. And I think healing is what we all deserve. And I'll go back and mention one thing. So Sean Ginwright's work was working with young men of color who were incarcerated in California. He's done a lot of work nationally as well. But what he wanted to sort of do is he walked in to work with these young folks who've come from really hard circumstances, who got put into boxes like this is who you are, versus seeing them for their whole being, recognizing change is possible, recognizing they deserve empathy and love and hope and all the other things, right? So he brings this whole different way of walking into systems where people have made mistakes, but that's not the end of the story for them, and holding space for who they get to be next. And if you ever have a chance to see him or any of his videos, I think that you'll be inspired by them. I want to just give you the definition that he uses for healing-centered engagement. A healing-centered approach is holistic. It involves culture, spirituality, civic action, and collective healing. A healing-centered approach views trauma not simply as an individual isolated experience, but it highlights the ways in which trauma and healing are experienced collectively. So ideally, this supports staff in their own healing. It asks systems to build in structures to address the realities facing staff. It helps staff better support patients and be present, because healing is a process we all need. And that's sort of why, again, we're starting with you today in order to build bigger, stronger muscles and skill sets in order to, and build on what the skill sets already were to begin with, in order to bring that kind of thinking to families. Part of the reason I care about this too is this idea of vicarious trauma that David Berceli, I think, sums it up maybe better than anybody I've ever read. He describes vicarious trauma as a change in the way you think about the world. Your worldview changes because of somebody's story. You heard a story about somebody and it really impacted the way you are in your personal life, the way you think about things, etc. But the idea, of course, is that when we work around families that have experienced trauma, we definitely want to take care of ourselves in that experience. And I'll tell you, when I was doing this work, I'll never forget it. I was in North Dakota. And, I was live in front of an audience. This is pre-COVID. And I was, talking and joking with the audience. And I was, talking about the need for self-care. And I all of a sudden see this wall of women in the back of the room cross their arms and kind of glare at me. And I went, oh my God, what did I say was wrong? So at the break, I walked up and said, hey, I can't ignore what I just saw. Like, I think I maybe said something wrong, or I'm just wanting to understand, I just felt this big wave and I just wanted to check in with you about it. And they said, Rebecca, you don't understand. We all just were sent last week to a self-care training to fix ourselves. And so this is like a little bit of bitter pill in our mouth. And I said, oh my God, self-care as a means of power and control from an agency had never really crossed my mind before. And I said, I'll tell this story forever because, it's wrong if a system is putting the onus on you. It's this tandem effort, right? It's this idea that self-care doesn't replace the need for organizational changes. And these things have to be held and looked at and picked apart together, right? To create the kinds of environments we need. This is a great resource if you don't know it. It's called Trauma Informed Oregon. It's on that long list of links that Kelsey sent you earlier. And they have a whole bunch of great suggestions for you there as well. And then, when I became a director at Planned Parenthood, I went from being frontline staff and doing health education and the phones and the front desk and filing and everything you can imagine. But when I became a supervisor, there was no supervisor school. So for my friends on this phone, if you went from being a frontline case manager or home visitor or person to suddenly overseeing staff, if you didn't get any training on that, you only know what you know. So I just want to acknowledge that and say that you're not alone. And there's tools available right now for you to download that's going to help you with this process of thinking about organizational practice. So this is taken from What About You, a workbook for those who work with others from the National Center on Homelessness. And I realized some homeless folks are birthing and mothers and others are not. But the reason this was created, and this is why it resonates across all programs, is because the burnout rate when you're working with unhoused people is incredibly high. It's a very hard population to work with. And they wanted to figure out, how do we retain people? What do they need from us? How can we support them? And so here's an example of a tool out of that toolkit that can help you as supervisors check in with your staff. Like, are you doing enough around training and education? What does it mean to be a good supervisor? Are you letting employees tell you what they need? Are you looking at your work environment? Are your light bulbs all fluorescent and blue versus warm? All of these little things make a difference. So I wanted to say to any of my supervisor friends, again, you're not alone. If you feel like you would like to do no more, but you just don't know where to start, this is for you. Also, I don't know how many of you on this call have a policy in place. So if one of your own staff, one of your own colleagues is experiencing intimate partner violence, do you have a process, a protocol in place to help them? And this is not to make anybody feel shamed or judged. Lots of programs don't have this because we're typically so outward focused on the client that we're not necessarily looking at what we're doing internally. So I just want to, again, acknowledge that. But this is an awesome tool, again, for my supervisor or manager or director friends. This is something else outside of work futures, which is called Workplaces Respond to DV, but they have like a whole template where you can write in St. Louis, Missouri maternal care program, and it'll populate the whole document. It has questions at the end, like, who's your local domestic violence resource? Have you talked to your EAP program, your employee assistance program about this? Do your EAP people need more training on how to handle this? It has really cool videos. So like if you have a colleague or a staff person who has a restraining order, how does that work in the workplace? What do you do if it gets violated? What do you do if partners calling on the phone to say, hey, where's so-and-so? And how do your staff handle that? Again, these are all things, how would you know how to do that, right? So it's really here to support the work that is so important, because we want to have you all taken care of as much as you're taking care of the families that you're serving. I think one of the things that I want to say about self-care is I want to shift it a little bit from the ways it sometimes gets defined sort of broadly in society. I think self-care at its core is a little bit about mindfulness and self-soothing, which can improve health and reduce burnout. So self-care for me, I mean, yes, it can be other things too that make you feel good. So is it a shopping or, bubble bath or whatever, but actually there's some science around soothing your soul when we do this work that matters. And I think that Audre Lorde really highlights this beautifully, because I think especially in COVID, I think especially given the stress levels, the running that we're doing, it is very difficult for us to access that, right? So in A Burst of Light, Audre Lorde writes, caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare. I think that's so profound, because changing our patterns, if we're running from thing to thing, I go from taking care of my kids to taking care of my clients to cleaning up lunch to taking care of my clients to all of a sudden it's 5 o'clock. I've been sitting since 8 o'clock and I forgot to eat lunch and I forgot to pee, right? So this idea that we have to be intentional, that we have to fight for ourselves, I think is so key to really changing the way our whole field is doing the work, because we know that burnout rates and people leaving the field are at some of the highest rates ever in the history of medicine. I also really think metaphors matter. And, you all have heard the analogy about put your oxygen mask on first on the airplane before you put on somebody else's, but I don't think that cuts it. I think that what we're really talking about, if we're going to be sort of healthier in the way that we approach our work, is that we're going to meaningfully think about buddy systems. And I think the idea of the metaphor of scuba divers is really powerful. So scuba divers use oxygen tanks to help them survive at sea. They would carefully check their equipment before going on their expeditions. They have to monitor their oxygen so they can get themselves to safety before they run out of air. But crucially, and this is the part where this is so different than putting on your own oxygen mask before you help someone else, scuba divers use a buddy system. We call them accountability partners. So they don't dive alone. And isn't that a beautiful image? Like, as you're thinking about your work, you're not in it by yourself, but you got somebody. You know that you need that person and they need you. So while exposing ourselves to secondary and vicarious trauma, we need to stay mindful to the extent to which our body's oxygen is being sapped. And that means slowing down. This goes back to my friend Audre Lorde, right? So being aware of what's happening, fighting to do it differently, being aware of our bodies, our hearts, our spirits, what is being told to us in that moment. And again, I think we run so fast, we don't give ourselves time to do that, just a little bit of self-check-in. So quick question, right? So when I'm out of reserves, I need to act. I can't continue being an effective helper to others if I've got nothing left. We all know this. Are you checking your reserves soon enough? And just take a second. Are you? I don't always. So this, in some ways I love doing this training because it's like, how are you doing, Rebecca? Are you walking the walk? Do I have enough in my tank to get myself to safety? When I emerge from the depths, what do I need to refill my tank? What a great question. And so this idea that, so many of us find it easier to help other people rather than taking care of ourselves. The cool thing about a buddy system is that you're equally caring about the other person and you're motivated to do that. So I really think this metaphor is powerful. And we're going to talk about using it again later on in the training. I really hope that this is not the only, this is a one and done conversation. I really hope that for any of you who are frontline folks, you say, I went to this training and it was really interesting. And she talked about things that we can keep doing at our staff meetings as a group to keep talking about organizational change, what we need to do to help each other, all those things. And this is a series on loss, self-care, and healing. And what I like about these webinars is that they're kind of in bite-sized chunks. So you could watch like 15 minutes of an expert saying, hey, have you thought about this, that, or the other thing? And you can try it on as a group. So I love this because you could keep doing this throughout the year. And of course, repeating that behavior, saying, hey, this is something we care about. We're going to carve out time. We're going to do it. Really does change the nature of the organization. I also want to talk about staff retention and what do we know. So this is data that came out of a home visitation study. And this is something I'm hoping we can hold on to in COVID. You know, one of the things that we know is people, all people care about autonomy and respect and respecting their time. And so one of the things that we've seen in many programs is that flexibility. So let's say I need to come in on Wednesdays at 10 o'clock in the morning because I got to get my kid from my house to my mom's house in time for her to get the kid all the way over to school because it's not much farther from where I live, right? And so the idea as you're thinking about creating a system where we really are listening to the needs of folks, it's almost more important than money. You know, when we can give people and honor where people are as much as possible, it makes a huge difference. It decreases burnout. The perception of control is associated with higher job and life satisfaction, as well as better performance and lower stress. So having some flex time, thinking about that, talking about that with staff. I mean, I'm sure for some of you are like, oh my gosh, I can't imagine that. But people are doing it all over the place. They're holding on to allowing for Zoom visits and some in-person visits and letting the staff person decide when the best slots are for that, and finding, you know, much more sort of happiness and engagement from the staff when they do that. So I think it's important sometimes to let the science drive the way that we're building our systems. Okay, I've talked a lot. I think we got our Zoom bomber off, and thank you all for surviving that with us. That was hard. I do want to ask you all a question. You can drop this in the chat. Name one simple way we can achieve greater good in the workplace, both for ourselves and our work. What are y'all thinking? You can share in the chat. Names one simple way we can do that. Asking for help. Having people in your circle remind you to check in is key. Checking in. Good, Sandra. I like that. What else? Be kind with ourselves, self-compassion, creating community amongst one another, setting an intention before you go to work, reflective supervision. We'll talk about that. Clear work time expectations, empathy, beautiful. Be clear about our boundaries and respect each other, building trust, patience. Okay, you got it. This is an awesome list. So let's concretize it. How do I get you those things that you just said are so important? How do we build systems that are going to allow for the capacity for more of those things? Again, it's changing the way we work, right? So we know that employees who took a break every 90 minutes for 5 minutes reported a higher percent of focus than those who took no breaks. And if you look at the second bullet here, those that took breaks had a 50% greater capacity to think creatively. And isn't that the definition of every single one of your jobs? Every single client, every single patient you take care of has a different backstory, is showing up with different symptoms, is struggling with a different issue, has concerns in a whole bunch of different kinds of areas. And all of that from you needs to be met with more presence that's really thought through. And, you know, I'm just going to encourage y'all to think about this. You can do this as a check-in. You can also do this as a group check-in, a system check-in. My supervisor friends have a contest. Ask your staff to set a timer for every 90 minutes. And no, I'm not saying if you're in the middle of a visit or you're in the middle of communication with a client, you're going to say, sorry, I need to take 5, right? But I am saying that after you finish that visit, before you check your email, before you launch into the next thing, that you stop. You set a timer on your phone for 5 minutes and you walk outside, or you set a timer and maybe sit and drink a cup of tea somewhere. I'm not dictating what the best thing is with those 5 minutes, but it's truly to take a break. And I think that what you'll notice is that when you give yourself just that little window, it changes how you feel overall. It changes how tight you feel at the end of the day. So I'm just going to encourage you. And so my supervisor friends, ask your staff to do it, keep a log, and whoever's done it the most, ask them to share out how they felt and, you know, give them a Starbucks gift card or something along those lines. And I think, again, in COVID, what happened was all of our boundaries got blurred. And so that thing about running, you know, some of you, if you're home visitors or you were doing case management, maybe going from home to home, you used to have time in your car or commuting to catch your breath. Some of you, if you're still working from home, that beautiful ride from work to home where you had 30 minutes, 20 minutes, an hour and a half, depends on where you live, of time to decompress. If you're at home, you're on as soon as you're done with your day, right? With your clients. It's like if you've got little people or other people living with you that you're responsible for, dogs, cats, whatever the things are, you walk out of that room and everybody wants you, everybody needs you. So this research is really looking at how important it is to just get that space and a little bit of time alone. So despite the social stigma and apprehension about spending time alone, it's actually something our bodies crave. We might not know that time alone is what we need to feel better. So I want to offer that up. If you're noticing that you're exhausted, some of you wrote that earlier in the chat, are you able to carve out this time? Maybe that's your body telling you, hey, maybe I do need a little bit more space. What happens when we have the freedom to do anything? Think about this for a second. No pressure to talk to anyone, no obligations to make plans with people. So time with your thoughts and without social distractions, and especially if you go from dealing with clients to being on social media, to checking your email, to checking the news, to doing all the things, right? All of those social distractions get in the way, I think. And it's important to acknowledge like that little spaciousness makes such a difference. So time with your thoughts without social distractions can also build your confidence, make it easier for you to maintain boundaries, boost productivity, engage with others creatively. And this is hard. This is harder than it sounds, right? So this is the time where I can give something to myself and just endorse that. In this moment, you are your first choice. And that's a hard thing. So one of the things I want to say right now, I'm a mother of 4. Don't judge. Uteruses work for a long time. My oldest is 32. My youngest is 14. But certainly, you know, some years back when I would walk in the door, it would be mom, mommy, mommy, mom. This thing happened. Can you drive me here? No. And I can remember walking through my house as fast as I could to get to the bathroom, locking the door and turning on the water because I just could not have all the needs all at once. So one of the things that I want to say to you is if you, like me, have people looking for you outside your plate glass window in the front of your house, think about parking around the corner from your house to get that spaciousness so they can't see you and knock on the window. Think about going through the drive-through at Starbucks or somewhere else where you're just in your car, nobody needs something from you in that moment. You can just take that time to breathe while you're waiting in line. I know that sounds maybe silly to some of you, but actually it's kind of amazing if you've done a drive-through and you notice like, okay, I'm not doing anything except sitting in my car and just having a moment. So I want to offer, these are little things that actually can make a big difference. And I've heard this from folks all across the from all across the country. Like all of a sudden they said, oh my God, I didn't realize how much I gave up when I stopped commuting because I don't have any space for myself. I'm like, okay, well, let's get you out in your car and take a drive, or out in public transit and, go somewhere. Okay. This is my favorite picture. This is a real picture of real children. The littlest one's name is Elta, and the big girl's name is Ellie. And Elta is my colleague who's the director of health at Future's daughter. She's now 16, so it's okay that we're showing this photograph. And Lisa was home with the girls, and they had gone upstairs to play. And in the meantime, backstory, Elta had been weaned off of her binkies or her pacifiers, right? So they had been washed, they'd been put away. Lisa was going to give them to another friend because Elta was all done. So Lisa's downstairs making lunch, and all of a sudden the girls are really quiet. She's like, oh my God, what are they into? Do they have a Sharpie? She's running up the stairs, and she busts open the door, and this is what she sees. And I've never seen a better picture of self-care in my career. They could not put more binkies in their mouths in terms of self-soothing. So I'm wondering if we can just do a little read of the room. How many of you would say you're a 5? You self-care, you think about it, it's conscious, it's part of your life. How many of you are a 5? How many of you are 4? How many of you are 3? You're kind of in the middle. How many of you are really struggling? Maybe you got little ones at home. It's really hard to prioritize or to carve out time. How many of you are 1? So I'd just love to see in the chat. Tell me about folks. And I see 3s and 4s and somewhere 3.5s, 2s. You're not alone, my 2 friends. 3s, 4.5. Thank you, Julia. Joan, Jeanette. And here's the thing, right? You're not alone in your number. That's what we're showing you right now. So many of you are in the same place, working on the same things. And what I'm hoping that happens as a result of today, and you can just think about this, I'll check back in with you at the end. Hopefully your number goes up a little bit, maybe go from 2 to 2.5 in terms of thinking about how you might do this structurally differently. And that includes like, I'm going to wait to make that phone call another 5 minutes. Or this is, again, a structural thing. What if your meetings were 60 minutes long, but you only ever let them run 50 minutes? And then that 10 minutes at the end is time for the staff, for yourself, to catch your breath, to regroup, to make a cup of tea, to do the things that we know are going to help you be in a better place when something comes up with your families moving forward. But you deserve to be in a better place yourselves anyway. I don't know if you've read Trauma Stewardship. This is a book by Laura Vandernoot-Lipsky. One of the things that many programs I worked with did, they had some leftover funding because of COVID. They actually sent out Trauma Stewardship to their staff as an audiobook or a hardback book because it's funny. It's, Laura talks about not realizing how crispy fried burnt out she was until she was literally standing on the edge of a cliff and thinking about coming off that cliff. Now, she didn't come off the cliff, but her description of cumulative stress and trauma associated with the work, again, makes everybody laugh. If you want another thing that you can do together in a team or something you can watch alone, if you're looking for inspiration about, not being alone in the fact that you are stressed and you want to laugh about it, then she also has a 19-minute TED Talk. So you can look up Trauma Stewardship TED Talk and find it. She also has a new book called The Age of Overwhelm, which I think is also really appropriate given COVID. And again, these are things that can be supportive to you in the work that you're doing. Okay, so now I'm going to ask you to take out a piece of paper and a pen, or if you don't have that, hopefully you have your phone and you can just type in the notes. I'd like you to think about one coworker, so not all your coworkers. And if you are a supervisor and you don't really have coworkers, I want you to think about one of your staff. And I want you to write down 3 good things about that coworker. Again, just one person in your mind. It could be personal, it could be professional. And if you can't think of anything, that's okay. All right. Now I want you to think about 3 good things about your most recent client. And if you can't think of anything, that's okay. That's part of the exercise. If you aren't seeing clients and you're supervising staff, 3 good things about one of your staff. And then I want you to think of 3 good things about yourself. What are your gifts in the world? And write those down too. So I'm going to give you a couple minutes to think on this. So you're writing 3 things. 3 good things about a coworker, 3 good things about your most recent client or staff person, 3 good things about yourself. And I just want to see, does anybody have any questions about the exercise I'm asking you to do? What if you're doing this work as an independently employed person? Tamara, are you working with clients? If you're working with clients, I would say that. And then maybe you could think back to a time when you weren't an independent contractor and you were working with somebody in that capacity. So that's a great question. If you're self-employed, let's think about, I mean, it's not perfect, but think back to somebody that you worked with that stands out for you. And I see our friend D1 Smith says, as she's thinking about her coworker, they were considerate, they were a motivator, and they were helpful. And feel free to type in the chat as you do this. 3 good things about a coworker, but I'll just give you a second to kind of finish up your exercise. I'm just going to take 1 second and get a drink of water here. Open-minded, generous, and supportive. Patient, reliable, and supportive. Passionate, caring, outspoken. Nice. Okay, so now my question is, did anybody write about somebody who's on this call today? Did anybody write about someone who's on this call with us today? For your staff person, encouraging, passionate. Cindy, so you're saying yes. So would any of you be willing to come off mute and tell us who the person was you were thinking of when you wrote about them? I would love that. Anybody want to come off mute? So it could be Yolanda, Ms. or person Smith, Michelle, Sandra. Do any of you want to come off mute and share with us?
Okay, I'm Donna Smith.
Hi, Donna.
I think Patricia, she is on my team. Hi, Rebecca. For Patricia, she's very passionate about the job she does. She's a home visiting nurse, and she came on with us a little less than a year. And I remember we were short of Creole interpreters, and we asked both Patricia and Eve to take up the task because they were orientating, and these ladies, they just step up to the task, and we really appreciate it because it was continuity of service for our clients.
Nice.
Yes, so
Is
that's
it
for Patricia.
For Patricia?
No, Eve. Eve is on with us today.
Oh, Eve is on with us. So
right, Eve, yes.
Eve, if you can hear us, would you mind coming off mute and sharing a little bit about what it was like to hear that about yourself?
It's actually felt very good to know that what you do is appreciated, and which is great but me and my supervisor, we have a great relationship because I already told her that I finally found a job that I will do for free.
Yes.
Oh,
yes.
That's wonderful.
I love the population that I serve. I love to see the gratefulness in their face, especially when you find a little resources for them and the thank you that you get, the appreciation. No amount of money can replace that.
Yes, and I will second that, because when I started 11, 12 years ago, I felt the same way, just the appreciation from the clients and also the support from my supervisors. I'm like, you know what? The money is not what I'm doing this work for.
Yeah.
So,
Yeah. Sometimes I hear people think about it as a ministry or as a call.
right, definitely.
Definitely that it's a calling.
Definitely.
So I really appreciate that. I would love, thank you so much both for sharing. Would anybody
You're welcome.
share about a colleague that's on this webinar today and share out what you said about them?
I will go ahead and share. This is Michelle Smith. So Asia, who is also on the call, she is our lead lactation counselor at our local nonprofit. We have a doula and lactation program, and she came on, I want to say in February of this year. And just in the short amount of time that she's been on, she has always been just very optimistic, very encouraging, like every step of the way. And her passion speaks through the work that she does. And from the clients that she serves, we always hear like how great and how thankful they are to have her supporting these families. And so she's been a light. And even before she even came on, I knew her, but to see her in this light, doing something that she loves, and soon she'll be at IBCLC. And so we're thankful. I'm appreciative of her, definitely.
Oh, beautiful. So Asia, can we put you in the, can we ask you to respond to what you just heard? Hopefully you got to hear all those kind words about yourself.
I did. Oh, thank you so much, sis. Michelle is my sis. I thank you. I really needed to hear that. It's always nice to hear that you're appreciative, because we're always on the run, as you said. So I have that go, go, go mentality. So it's nice to know that I'm being appreciative. I appreciate Michelle. She encourages me. I look to her for wisdom when I'm not sure how to handle certain clients or doulas, our CLCs in our program. So thank you so much. I appreciate you, sis.
So what we just got to see is the power of something that you can think about doing on a regular basis moving forward, right? Because think about if on Fridays, on your windshield, you got a sticky saying, "Hey, Jasmine, I just wanted to say you inspire me. I love the way you love your clients, and and the way that you're respectful of your families," or whatever the thing is that we're going to say. If that could be a regular part of what we do, because everybody feels good right now. I don't know. I mean, to note it, well, I hope so, but notice yourself from top to toe. It's inspiring to hear joy. It's inspiring to hear compliments. It's inspiring to hear that, people are doing a great job. So I want you to think about that and think about, could you integrate this into your staff meetings? And we start with affirmations, or could it be notes? I talked a little bit about things learned in COVID earlier. And remember, I told you about the home visitor who wrote every single one of her clients a personal little note about them, like complimenting them. I bet all of you never finish a visit without saying something positive to a family or to an individual. And I would just want to encourage you to think about maybe making a little change in what you do and writing it down on a sticky, right? So I just want to say, I noticed this, this, and this, because I guarantee you that's the thing that's going to be on your client's mirror or on their dashboard or in their wallet when they're having a moment, because there's something different about when we say the words versus when we take the time to write the words, because then you can kind of hold on to them. And if I were to ask you all of the three things, writing about a coworker, writing about a client or staff person, writing 3 good things about yourself, people would say the hardest thing is to write something good about yourself. So you can see the power of that first exercise where you were hearing from someone else through their eyes who they see you as. And that's something, as you're working on your worthiness, because we all are worthy, that's a thing to help build those muscles, because maybe you've had a history of people not celebrating your strength, your gifts, your passion in the world, the ways that you are able to help others. So I just want to leave you with, this can be bigger. You can take it as big as you want. And I think it's something that really feeds the soul, and it's simple, it's easy to do, it's free. And I guess the other thing that I've been thinking about in terms of, you know, what do we want more of and what gets in our way? I don't know if you've had an opportunity to ever see Brene Brown speak, but she's pretty interesting. She's a researcher. She's a PhD at a University of Houston. And she's somebody who looks at shame and somebody who looks at vulnerability. And she looks at connection, like what are we looking for and what gets in the way of our ability to connect, right? So neurobiologically, our brains and our bodies, we're wired for connection with people, right? So what gets in the way? Shame, fear, vulnerability, not being able to take that step forward, not being able to share, fear, all of those things. So, but in order for us to build connection with others, we need to be seen, really seen. And to do this, we need courage. We need to connect with our whole heart. And that means we need to be present with ourselves. So I want to give you another thing to put in your pocket to take home with you today. And that is a cape. So if we think about what gets in the way of our ability to connect, vulnerability is part of that. So I want to tell you a story. So I grew up in a very abusive home in rural Colorado on a dirt hill. When they put the stop sign in, it was shot down every week for most of my adolescence. Gives you a little sense of where I was in rural Colorado. And when I left Colorado, I moved to San Francisco. My sister moved to Manhattan because we both felt like maybe we would be better off if people could actually hear people when they were yelling and needed help. So like a lot of folks who grew up in homes with abusive relationships, unfortunately, my sister, when she was in Manhattan, found herself in a very complicated relationship. So I get the phone call. This is pre-cell phones. I get the phone call. I'm in San Francisco. And she's like crying, sobbing on the phone and saying this, that, and the other thing. And I say, oh my God, I know what's going to happen. I'm going to get a ticket. I'm going to fly to New York. I'm going to call your friend Eric. We're going to get in a cab. We're going to time it. We'll figure it out with your neighbor so that you know when we're coming. If you can't use the phone, because I know he's not letting you use the phone all the time, and we're going to get you out of there. And we'll bring an extra person. We'll get your suitcases out of there, and then we'll take you to Eric's house, and then we'll figure out a plan. Was I listening to my sister? Or was I dealing with my own vulnerability in that moment? I was feeling really vulnerable, so I put on a cape so I could fix it. And that was the last thing she needed. What she needed was her big sister to say, I'm so glad you called. I'm so sorry. What do you need? I'll let you drive. But the part of me that, and the part of us, I think, when we're all stirred up, which is why this whole exercise around being still, being clear with yourself when you're getting triggered, when you're getting stirred up, so that you don't throw on your cape. And I'm going to guess many of you have capes in this call. Many of you have several. Maybe they match with your shoes. But as you start thinking about how you handle things with clients, you can see how that taking over comes with a cost, right? So thinking about how we can be more aware of when we're reaching for our cape, putting our cape back, telling ourselves, wait a minute, this is about me feeling like I want to fix it because that's going to make me feel better. I need that sense of control in the moment. And this shows up in all different kinds of big ways and small ways when we're doing client care. I think that this metaphor or this way of thinking about where am I and in relation to the other can be really powerful. So I wanted to ask you all, what do you think we take away from others when we use our cape? And you can share in the chat. What do you think we take away from people? Their voice, decision, their voice, self-determination, ability to grow, their autonomy. Have to take off the cape so we can have autonomy, their own voice, their autonomy. Yes. And you can see how it's the last thing, actually, when we go back to Brene Brown, wanting to make connection, that we want, because when we fix things and we are dealing with, I feel anxious, I feel vulnerable, I'm putting on my cape, we actually create disconnection with the people that we care about the most, or the people that we're hoping to connect with the most. And so this whole thing about slowing down is about not falling into that pitfall of throwing on the cape. And I say this as someone who literally has one in every single container in my house, my glove compartment, my purse, my junk drawer in my kitchen. I mean, I have a lot of capes, right? So they're loud, they're all around me. I wanna use them. And it has been the most profound work in my adult life to put them down. So if you're thinking about needing to put some down too, I promise you, you're not alone. The other thing I think you all deserve, and I don't think you all have it, is something called reflective practice, right? So do you have time, paid time in your week or every couple weeks, or you have some one-on-one time, not to talk about a case conference issue necessarily, but really to see where are you and how are you? It could be in relation to a client you're working with. It could be in relation to something else, but having some space to unpack all the things that you're carrying in your bag is so important. And so if your program doesn't have reflective practice yet, I'm going to say, I think this is a trend. I think it is. If I were writing policy for your state and we were looking at sending out, RFPs for people who are going to be doing maternal care, I would say, and if you're going to apply for this RFP, I expect that this program will have reflective practice as part of it to promote best outcomes for staff and for clients. And that's really something I think you all deserve as the wonders in the field that you are. So I'm going to ask my friend Kelsey, are you on still? To do this little role play with me. Can you hear me, Kelsey?
Yep, I can hear you.
Perfect. So I'm going to set this up. Nice to see you, Kelsey. How are you doing? Have you shaken it all off?
Working on it, yeah. Hoping that everybody got back in that wanted to.
Great job. Look at all you accomplished. I'm so proud of you and thank you. So for the sake of this exercise, everyone, I'm going to say that Kelsey and I have been working together for 20 years, 15. Okay, Kelsey's too young to work for me. 20 years, 10 years, Kelsey. And I know everything about you and you know everything about me. You know that I have 4 kids, you know that I sometimes hide around the corner in my car before I let my kids see that I'm, coming back from work. I'm passionate about what I do and I know all the things about you. I know that you have a very sweet person in your life named Nick who can help in a moment when needed. And I feel really happy about that for you. And so anyway, we know each other very well. So it's Friday night, it's 5:15. I'm in my car and I'm calling up Kelsey. So Kelsey, I'm calling you, you answer.
Hey, Rebecca, how are you?
Oh my God, Kelsey, you wouldn't believe what happened with my day. Like everything that could have gone wrong with that mom that I told you about that I've been so worried about, I totally missed it. I totally missed what was going on for her. And I couldn't believe it. Like she walked in and I was like, oh my God, I missed that was all going down with her around him not letting her go to the store, access money, any of the things. Like I didn't realize the reason she didn't have enough food is because she didn't have access to being able to get into her bank account. And I feel like a total failure. And I'm like, And then she's got these other 2 little kids, and I'm trying to figure out all the things to do about that. Kelsey, how did that just make you feel?
I felt like I really wanted to support you in that moment and to reassure you that you are not a failure and that we are all human.
So great that you said all those things, and I'm sure all those things are true. But the question I asked you, Kelsey, is how did you feel? You feel in that moment?
I felt a little overwhelmed.
Fair. And in fact, let's think about this for a second. It's 5:15 on a Friday, and I have no idea what's going on with you. I don't know if you just got a call about, somebody being sick at preschool, or your mom having COVID, or your husband lost his job. I have no idea what's going on with you, because I didn't ask for consent. I didn't say, hey, Kelsey, do you have a minute? Something's going on for me, right? I didn't give you fair warning. Something's going on for me. Do you have a minute? More importantly, prior to ever making that phone call, I did not check in with myself, right? So I'm spinning completely in the utter ugliness of spinning around in circles. And I hadn't taken the moment to catch my own breath and say, okay, that was really hard. Let's just take a second. Let's just take a second, so that I can find my feet back on the floor and think about what to do next. And I didn't limit the disclosure. I just let it all rip. I didn't, had I had a moment to catch my breath, I might have said, I had this thing go down with this mom. I did this, but I feel like I'm missing that and the other thing after I've asked you if it's okay to talk about it. And then we could actually kind of get to the next piece. But I think one of the things that we do often in healthcare is we dump in the name of love. Like, I'm allowed, because we're on this team and this work is really hard. I get to call whenever. I get to talk about whatever I want in the hallway, whenever I want in the hallway. I get to pull you around the door. If you're eating your lunch, I can come and sit down and dump all over your sandwich. And I'm saying this because I've done it. I've experienced it. And it doesn't help with changing our environment to be less stressful. It actually adds to it. And so these are thinking about low impact debriefing. Are we taking these steps to do this? Asking ourselves, it's kind of like that buddy system we were talking about with the oxygen. Are we asking ourselves, wait a minute. Okay, I'm coming back up. Where am I? What do I need? What just happened? And then being in a different place to open it. So I think that is a very powerful thing to concretize and talk about, because again, we do it and we've been taught it. I mean, this is how I started out working, in clinic, and I learned to do this day 2. Nobody gave me a pamphlet on how to do it, but I watched it. I watched that this is like, you were allowed to do this as part of your process. And I just know that it's something that is not helping anybody. Okay, so Kelsey, thank you for letting me dump all over you. I promise I did tell Kelsey. Kelsey was made aware that I was going to dump on her before I dumped on her. So I do want to say that. We're about halfway through. Our timing is obviously off because we all experienced a Zoom bomber together. But I before we take our break, which is the next thing we're going to do, I just want to know what's standing out for you. And you can type in the chat or you can come off mute. But we learned a lot together for this first part of our training today. Is there anything that's standing out for you? I'll let you in chat too.
Hey, I came off mute. I'm Tamara. I think the one thing that stands out for me, I'm the one who said about working on your own. So a lot of my work is contracting, and I'm also a doula and a childbirth educator. And it reinforced the importance of network and whatever network you have, because we show up in this space doing so many things. I've done the frontline work, I've done the supervisory work, but always have a network, always have a team of people that are supporting you. And for those people who are supporting you and that you're supporting who may not be on this call, how can we share that with them so that we're all coming from the same space? Because there's burnout everywhere. We want to do so much and be all the things, but we have to be intentional about building those networks or using the networks that we are part of, not using them, but being engaged with them.
Thank you. Really wise and really helpful. And as somebody who's also a contractor, like, it gets lonely. It's nice to have a place where you can be intentional about, on Friday afternoons, I'm gonna meet with so-and-so who's doing similar doula work, and we're gonna just have coffee and talk about that. So I think that's just super smart in terms of more connection and not being the only person that's out there helping, but rather, what do you need to recharge? Anybody else? What you'd like to share? Something that stood out for you?
Hi, my name is Asha.
Hi,
I
Asha.
really like the last part of what you said about the low impact debriefing. I was thinking about something that happened earlier today with one of my friends. She's an up and coming doula, but she's also a mom of two, and she also has a business. And she's got a toddler and a preteen, and like she just had like a big situation happen today, and it was just like a whole bunch of stuff just dumped on me. And I was just thinking about this as you were talking about this low impact debriefing. I was just like, I thought it would have been like, if she knew to do that with me, or even if I knew to do that with her, like, I would have been able to process what she said better, and I probably would have been able to give her a better response.
Mm-hmm.
Because when she was telling me all these things that were happening to her, like early in the morning for her, because we're here in New York, all I could say was, wow, that's a lot. That was literally my first response, because it was so much all at once. It was so much all at once. It literally took me like a good few minutes to come up with something sensible, other than like, wow, I'm sorry that happened to you. Wow. That's literally the first thing that came out of my mouth. And I was just thinking, if she or I particularly had the ability to unload something like this in a manner that's like taking a step down, and like instead of jumping off a cliff, I just think I would have been able to be in a space to help her better, or even to receive help if it was in my case. I don't know. That's just my take from it.
Mm-hmm.
I thought it was awesome.
You know, and going back to sort of Audre Lorde's piece, right? It's about self-soothing, and are we creating space for that? Because what I hear you saying is like, oh my God, that's a lot. That's a lot. It was a lot. And would it have been possible to just, for her to go get in that car, go through that driveway, lock herself in the bathroom, turn on the water, catch her breath, catch her thoughts, and be in that place of being able to sort of unpack it and look at it a little bit differently before she made that call to you? Mariana, I see your hand up.
Yes, hi everyone. It's, with everything kind of said today, it made me think about how I identify as a whole human. Like I would say that I am very compassionate, but I have a lot of empathy. I feel like you have to have a lot of empathy in this work, right? And putting yourselves in people's shoes is a critical kind of lens of where I do a lot of my work in. And so it's just this fine line of balance. It was a reminder of like how you can still be an empath, but also not suffer from this compassion fatigue. And also giving yourself grace, right, in the process of it. And so I just really appreciate just everyone's stories and your own stories that you've shared in this space, because just a reminder that we come with a lot of our own history and our own healing work, and it shows up in our lives, and it shows up in the way we interact with each other. and kind of how to be graceful in that within ourselves and others. So just a core theme that I'm seeing in many areas of my life. And I wanted to just share my thoughts on that.
Brandon, that was absolutely beautiful. Thank you so much for sharing. Vanessa, I'm gonna ask you to come off mute, and you definitely can speak, but we're gonna stop then and we're gonna take a break. So I'd love to hear from you, Vanessa.
Hello, I'm Vanessa. I'm a doula and an IBCLC. And so the reflections that I had was, one, it just made me grateful that I have utilized therapy on and off for the past several years because, like somebody else mentioned, being an independent doula, like I don't struggle with being lonely because I've been very intentional about having community. And I was the one that mentioned in the comments about having to circle other people to remind you to check in on yourself. But the other thing that comes to mind, I think, is like boundaries is when people are dumping on us, having strong boundaries to say like, wait, I need you to stop. I'm not available to receive this right now, or I need a minute. Like, can I call you back in 5 minutes so I can kind of get myself together? So I think, there's a lot of things going on. And then with the cape analogy, someone asked in the comments, like, when is there a good time to put on the cape? And I just thought there's never really a good time to put on the cape because the cape is for the other person, for the person who is having the issue. We're not meant to have a cape for someone else's issues.
Exactly. We're not meant to have, nope. They didn't say, could you please put on your cape for me? In fact, what they're looking for is, wait, can't you just be with me where I am? Really? You can't be, right? So no, nobody's looking for that cape. That is about taking care of your own feeling of vulnerability, your own feeling of overwhelm, wanting to fix it, wanting to take control, right? Let's think about this for a second. Wanting to take control of the situation. I know better than you, which no, you don't, because that person is the expert of their life. And so it really allows us to check sort of some of the power and control things that show up in, longstanding histories of power and control and institutional power and control and legacies of that, which we'll talk more about tomorrow. But, checking that idea is so key to changing the way we hold people and really moving us toward this wholeness and healing space that I think everybody deserves. So I'm going to stop there. I loved all of your comments, and I'm really notice what you do in the next 5 minutes. If I'm really hoping you can do something for yourself in the next 5 minutes. If you can't, no one will judge you. I just want you to notice, and then when you come back, you can share what were you able to do. So I will see you in 5 minutes. Actually, I'll see you in 7 minutes. Let's come back. Kelsey, I can't do this Eastern Standard Time, but so at 11:05 my time, which would be
2:05 Eastern.
2:05. I'll see you at 2:05. Thank you. Okay, so I would love to hear in the chat, what did you do? Were you able to take a break? Were you not able to take a break? I will, true confessions, my husband is home and I went and got a great big hug because I've never been Zoom bombed before. So that was real. Disha, I hear you, continued working. Diana made lunch, sent 2 emails, called my brother, snacked and puppy kisses. Okay, good. Gave my dog kisses and cuddles, picking up grandson. Went outside, felt the sun on my face, made a cup of coffee, working, and right, the thing is, it's a process. So, maybe this time you didn't do it, but maybe if you set your alarm for 90 minutes from now, maybe you'll be able to do a little bit more. Set my intentions for my career and academic goals. Love that. Continued working from home. So it's a mix of things, but I'm glad that we had a chance to sort of think together about, collectively, right? This is an incremental process. I've certainly been the person who continues to work through any break that's been offered to me as well. So, but I'm trying all the time to be in a better place. So, tomorrow we're going to have a big day looking at issues of adverse childhood experiences, intimate partner violence, trauma exposures. And I would love to hear what you're most worried about. What keeps you up at night? What are the things that you're, that come up for you as you think about those topics? And you can put it in the chat or you can come off mute. But what are you most, when it comes to thinking about IPV and trauma exposures, what are the things you're most worried about? What keeps you up at night? My children, not being able to provide for my family. Thank you for sharing. Having to go to the office, uncertainty of the future and failure. I'm really anxious about my children returning to school this year as gun violence increases in schools. I hear you. My future, breastfeeding baby. Not being able to help others. Balancing work and marriage. Having no time to be actually present with family and overwhelmed with work. Ditto, not enough staff, not enough. Okay. So one of the things that I want to say, because I don't know about you, but in the middle of the night, when I wake up having anxiety about all the things, right? Gun violence at school, at our school in Berkeley, last day of school, there was a young person with a gun found in their backpack. So I know that feeling, unfortunately, all too well. They caught him first, but that happened. I feel like, well, what do we do as we're worried about finding the balance or not being able to help as much as I need to help or not knowing what to do next? I feel like, again, this idea that being kind to yourself is something that might be hard to access for some of you. It certainly is for me sometimes. So I have this written down next to my bed. I can only be myself in this moment. And when I am myself, I am enough. And I think there's an enormous amount of power in those words because it takes away the woulda, coulda, shoulda. if, ands, or buts. And I can only be myself in this moment. And when I am myself, I am enough. I think that that can give you that little bit of comfort as you're trying to figure out that next little piece. So this is something that gives me comfort and has given other people comfort. It was actually from a home visitor in, I think this was in Alaska, actually, who shared this with me. And I thought it was so profound. I went ahead and put it into my slide deck to share it with others. So I want to shift gears and talk about the FAN, which stands for Facilitated Attuned Interventions, as a way to reduce staff burnout and a tool for all of you. You know, and I'll just tell you a quick story. So we were at Futures looking for a way to help providers stay calm and regulated and present to themselves and their clients in conversations about traumas, including domestic violence or intimate partner violence. And I was introduced to Linda Gilkerson and her work. And, you know, you look at the second bullet and it's like, we discovered the Fussy Baby Network. It's like, okay, what does fussy babies have to do with intimate partner violence? But actually, you know, if you think about sort of how do we support staff and how do we support staff who have to carry a lot from their client load, it makes sense that the Fussy Baby Network is a perfect set of tools to apply to other kinds of issues like trauma and intimate partner violence. So I'll give you the backdrop. The Erickson Institute in Chicago is a place you get your master's or PhD in infant mental health. And so the Fussy Baby Network in Chicago, Illinois, and I think it's actually statewide, is a home visitation parent support for parents who have fussy babies in order to prevent shaken baby syndrome. So they send out caseworkers to support families, to do education, to help them get through a tough time. And so she would send out these new social workers who are just still learning, right? They're in 20-something, early 30-somethings, and they're going into a family's home that maybe has been up for 24, 48, 36 hours, a long time, not enough sleep, really hard. And the parents would answer the door and share with the home visitor, you know, my baby hates me. I wish I would have never had my baby. My baby's evil. I wish there was a different mommy, you know, all the things, right? Just big, huge, emotional, owie things to say that the home visitor was then holding. And so she had staff who would come back after doing these home visits and say, I don't know if I should be a social worker, Ms. Gilkerson. I don't know. Like, I don't know what to say. It like made my heart race to hear like my baby's evil. Like I didn't know what to say back, all the things, right? And so Linda realized that she needed to create a way to hold staff when they have those moments they get triggered. Now, part of this is also having reflective supervision, which they all get to. They all get support in their program to unpack and process this. But in real time, in the moment, in somebody's home or in a clinical setting, or as you're working with family or an individual, you know, what helps? And so she came up with this model called the FAN, and it literally looks like a fan, as you can see. And we're going to be talking about just this first wedge of the FAN. It's called calming mindful self-regulation. But the idea of the FAN is that the FAN is set up so that you are being present with the person in front of you. So is what that person is engaged with, is that what you're engaged with too? Or are you trying to do something else? It goes back to that cape analogy. So for example, the next wedge is feeling. Somebody's having a lot of big feelings. They're crying about something, etc. And so are you able to sit with, wow, thank you for sharing that with me, and sit with them and their tears? Or do you jump with your cape to doing, even though your client is in a place of feeling? So this FAN kind of gives you a little check on, wait, am I in the same place that they are, or have I jumped to something else? And the FAN isn't sequential. It's not something you do in order. You know, you might walk into a conversation, the client is interested in doing and taking action steps, and you're going to support them in that. You might have a client who's really kind of trying to decide about something. They're in a thinking mode. They're wondering about things. And so you might be able to support them in that. Or they're in big feelings. And how do you stay with them in big feelings? Because that's a place where I think our capes come out. We want to fix it. We want to take control of it. We want to tell them what to do. And we really don't want to do that. So the only way to control ourselves from putting on that cape is this mindful self-regulation piece. I got to be present with what's going on with me first in order to help somebody else. Okay. So if we were able to go into a million Zoom rooms, which we cannot right now, or if we were in person, what I would have you do is turn to the person next to you and say, what has the last 24 hours been like for you so far? And when I say that, I don't mean I went to the grocery store, I got a cup of coffee, I answered emails. I mean, like, really, it's been a bad day? It's been a great day? Was there something to celebrate? Was there something heartbreaking? So I want you just to take a second and think about what the last 24 hours has been like for you. And you can take down notes if you want. What happened in the last 24 hours for you? Was it good? Hard? Just take a second to notice. So the next part of this exercise is you get to do this in dyads, right? So each of you get 2 minutes to talk about what the last 24 hours was like for you. And the other person needs to just listen, which is harder than you think. Really just let you talk. So for example, if I were in a room right now with you and you said, hey, Rebecca, what was the last 24 hours like for you? I would say, I really felt violated by the bomber. That really upset me because it came from nowhere. I didn't know how far it was going to go. I didn't know why it was happening. I would have been very much in all those thoughts and feelings and unpacking that. And in the process of unpacking that, I'm sure that I would have noticed things that I wouldn't have had time to notice because it all happened so fast. And one of the things that I would also notice is that when I took time for the break, I went and got a big hug because that made me feel better, right? So this idea that you're taking a minute to notice good, bad, hard, ugly, joyful, wonderful, but just taking some spaciousness around it has a lot of power. And then listening, because when we let someone talk, they might discover things that they weren't aware of, right? So as I was telling my husband the whole story, I said, I felt so violated. I felt so like, I felt messed with, and it, I don't know. And so I don't think I registered all those things in the moment, but I registered them when I gave myself a couple minutes to think about them. So, and the same thing, there's a lot of power in being listened to, right? And sometimes when I do this exercise, what is it like for you to have someone be present and really listen to you? Sometimes when we do this exercise in person, people will say, it was kind of awkward. I'm used to listening to people all the time, but it was kind of weird when I had to talk about it. Or they say, I could have talked for 10 more minutes. Like that was awesome to have some space to think about it. Or I had an epiphany because of what happened. So we're used to giving our attention to the other person, but way less used to being listened to. So going back to my scuba diving buddy idea and low impact debriefing, what if this was a ritual you did with your buddy? So my doula friends who are, contractors who are not necessarily working in the field, one-on-one shoulder to shoulder with folks, what if you had another doula that you did this as a ritual. So on Wednesday nights at 5:20, we're just going to call and debrief our day. And I'm going to give you 2 to 3 minutes and you're going to talk. And I'm just going to hold that. And then you're going to give me 2 to 3 minutes and I'm going to talk, and or vice versa. And that in and of itself is a way to dispel some of the stuff that we're carrying around in our bags and give us perspective, right? Because we're slowing down enough to talk about what's happening. Now, I'm not saying this is replacing reflective practice, but this is something that you can be doing on your own with each other that we found to be really helpful. And some people are doing it even as a ritual every afternoon or in the mornings, depending upon what your schedule works like. So I'm going to stop myself there and ask you thoughts on this concept. Anything that's standing out for you there? Building and listening and being present. I have a two doula group chat. We use FaceTime, Marco Polo, WhatsApp to have community. I felt understood, heard, and I matter. That's great. So I guess the part of this that I'm really thinking about is the human part of all of us, right? I want you to think about when you felt like someone really got you, that they really truly understood you. Oh, Vanessa, I see your hands just now. Go ahead.
Oh, I forgot what I was going to say. Can you go back to the last slide?
I can go back right here.
Oh, I was just going to say, years ago, I did this leadership training. And in the leadership training, we had to, we did small groups, so 2 people, and you had to get feedback from the other person. So of course they couldn't say anything really negative, but they were kind of giving you critiques, and all you could do was say thank you. That was such a difficult experience, because usually it's when people are complimenting you or even giving you feedback, that's not ideal. Sometimes we want to get defensive, and it was just a great activity to be able to listen to someone else, and then you would repeat that, and really practicing how to be present and how to listen and receive what people are saying to you, even if it's difficult. I think that probably really helped me to be reflective, because I could kind of think about what someone is saying. And then I also had to repeat that for another person.
Yeah, no, I love, there's lots of tools and techniques out there. I love that. And I also love this, because the idea of setting the stage not to be critiqued, but just to let it flow. Where are you in time and space? I got you in time and space. And then being able to do that with another person, that frees up a lot of capacity. And I want you to think for a second about the person who really gets you in your life, right? Somebody who truly understands you. How do they show that they get you? How do they show it? Want to show me in the chat? How does that person show it for you? They listen, they validate. Thank you. They make me feel validated. I bet they don't judge. I bet you feel like you can say your stuff and they say, thank you for telling me that. And really, if we think about it, that's what we're all starving for, that connection that Brene Brown was talking about. We're all starving for connection. Our clients are starving for connection. And our teams, as individual people, we're also starving for that. So how do we have more? Because when we have attunement with another person, when someone feels really known or understood, the attunement that occurs creates a space where it's possible to try new ways of interacting. So it's a way to kind of move forward to repair if anything goes wrong. When someone feels truly understood, they feel less fragmented and more coherent, right? The world makes sense to you. And safety, which is something everyone deserves, safety replaces anxiety and releases capacity. So we want to create these environments where people feel seen, held, and heard, and we put away our capes. So the process of attunement is about seeing the world through the eyes of another. And someone else shared that earlier, that empathy is about really trying to sit in someone else's shoes and again, put away that cape. But if you think about it, especially for survivors of trauma, intimate partner violence, domestic violence, they may have experienced a lack of attunement from friends, family, professionals, often those who want to help the most. Why? Why? Right? Because we haven't really examined the fact that a lot of us put on that cape, right? The stakes are high. We're worried about somebody's safety, or worried about, what's going to happen next, or it sounds really dangerous or hard, or just mean. It doesn't have to be abusive. It just sound, mean and controlling. You can see how family, friends, professionals all want to throw in that cape to fix it versus sitting with that person. And so it's especially important as we're getting ready to talk more about intimate partner violence, domestic violence tomorrow, adverse childhood experiences, that we're paying attention to that and we're not falling into a trap. So first, we have to be attuned to ourselves. We have to pay attention so that we can believe in our own capacity, so we can help others. And the whole idea of this is that it's a parallel process, right? The idea is I want to have an organization that's holding you. So has that protocol in IPV, is checking in with you about what you need to be happier and healthier in your workplace. So that the staff can, work on holding and containing themselves and getting permission, even directions, like I really want to see you take breaks. We know it matters. So that they can then have more ability to be present, so they can hold the parent. And I think this whole idea of the fan is something we absolutely can teach families, so the parent can hold and contain themselves, so they can hold and contain the child. I don't know about you, but I have broken up with Siri, my GPS on my phone, more than once. I've replaced her with a man from New Zealand because Siri somehow didn't understand my voice, and he does. If you think about when you put in, your address that you're trying to get to into your phone and you turn the wrong way, what does your phone say back to you? You've got your driving directions on. It says recalculating, right? It says make a U-turn in 2 blocks. Well, really the idea of the fan and the matching process is noticing, oops, I took a wrong turn and I need to figure out how to come back and make it right. So it's about sort of that noticing piece that a GPS would be doing, is noticing you took a wrong turn. So I mentioned to you all earlier that I have 4 children, and I wish I could tell you my youngest was the easiest, but that would be a big fat lie. She was my hardest. She's the only kid that I needed to put plexiglass on all the windows, because when she was 18 months old, she figured out how to crawl up in the breakfast nook, push open the windows, and then she was straddling a 5-foot drop onto a patio and the nook and then the table, right? So she could have whacked her head on that side or on this side. So we had to put plexiglass on all the windows so she didn't die, little things like that. She was always moving. She could move furniture, climb on anything, on the top of the bookcase, get the cookies, all the things. So the day that Eva's sitting on her bed quietly as we're getting ready to go to a party when she's about 4, I should have known something was deeply wrong. So I'm in a hurry, right? Because it's like, honey, we got to get your shoes on. We got to go. People are in the car waiting for us. Let's go. And I, again, it's sometimes it is about being present, isn't it? So I hear this little voice and I'm in a flurry looking for shoes. I know I wasn't supposed to do it. And I wouldn't do it again, but I just wanted to keep it with me always. And I'm like, Eva, get up. Let's put your shoes on. Let's go. And she slowly gets up. And what do I see in her dress? Brand new, never worn. She cut out the pink polka dot in the crotch of the dress, and she was holding it in her hand. I wish I could tell you at 5 feet 9 inches tall, I did not yell at my 4-year-old and say, oh my God, what did you do? And she burst into tears. And I'm like, oh my God, I'm 5'9". I just yelled at a 4-year-old because what? And if I step back for a second, she said every single word she needed to say when I walked in the door, but I wasn't being present with her, right? So I get down on the floor and I say, Oh my God, even mommy should not have yelled. And you know what? I didn't listen to you. I wasn't being a good listener. You told me everything I needed to know, that you didn't mean to do it. You wouldn't do it again, but you wanted to keep it with you always. And you felt bad about it. And I can see that now. And I'm so sorry. I never should have yelled it to you. Now, it wasn't a great parenting moment, but we changed her dress, dried her tears, you know, gave her a big hug, put on a new dress, told her it was going to be okay. We'd figure it out. And it's going to be a funny story someday, because not everybody cuts out polka dots out of dresses. And so the point of that story is this, right? When you do something that doesn't work, or when something blows up in a relationship, you know, you have an opportunity to repair it and do that U-turn, so that you can grow closer. That's actually kind of how you build trust. It's not through having perfect relationships. It's through the way you repair the relationships when you mess up. And who among us hasn't messed up about 1,000,000 times? So I want you to do another little exercise with me. And this is really and truly something I think you could do with your families as well. So again, on a piece of paper or on your phone, I'd like you to write down, using adjectives, what are you like when you're feeling balanced and regulated in your body? So what is physiologically happening? How do you notice that you're feeling balanced and regulated in your feelings, in your thoughts and behaviors? And then turn the paper over or use a different sticky note. What am I like, or use a different note in your phone? What am I like when I'm feeling dysregulated or not in balance? And write down those adjectives. So I'll give you a couple minutes to notice. And when you're done, if you wouldn't mind putting a thumbs up on your reaction screen, so I know that you're done, that would be great. So just adjectives. What's it like in your body? Feelings, thoughts, and behaviors. I see one thumb up. So if others wouldn't mind putting your thumbs up when you're done. Otherwise, I'll give you a little bit more time. Okay, I see another thumbs up. Thank you, Jasmine. So while folks are finishing, I'm going to ask, you can put in the chat, what are you like when you're feeling balanced and regulated? What are you noticing about yourself? What are you noticing? More energy. Thank you, Sandra. Calm. more relaxed and motivated, calm, happy, curious versus anxious, worrying about other things, distracted, confident, calm, productive, patient, attentive, able to enjoy life, happy, yay, motivated, thinking clear, focused, stronger, motivated, positive, friendly, enthusiastic, relaxed, energy, happy, more space between my stimulus and my response, Kelsey. Good. Lighter, calmer. Nice. Okay, so what are you like when you're not in the good place? See, what are you like when you're not in the good place? When you're not in balance? My body feels tense, isolated, depleted, frantic, heavy, absent-minded, focused. I would say deserving of every carb in the vicinity of my body. Short-tempered, irritable, all over the place, tense, anxious, angry, grouchy. And if you're noticing in your body, does anybody notice like your shoulders get tight or you get a stomach ache or a headache? Achy. Yes, you're noticing that. So, you know, my kids they're like, Mom, what's wrong? And I'm like, what do you mean what's wrong? They're like, look at your foot. And when I'm upset, I'm a foot tapper like this. So I'm shaking my foot, and it's true. If I'm shaking my foot, I'm not in a good place. Shoulders get tight, lower back tenses, sleepless nights. True, Margie. I think that's for a lot of us. I do the same thing. So here's the deal, right? We took a minute to notice what we're like when we're in a good place. And we took a moment to notice what we're like in a not such good place, because the thing is, you probably don't sit and ruminate it on, think about it all that much, right? So I gave you a little bit of time to think about it so that ideally, if you're noticing your shoulders are getting tense, you're breathing shallowly, I'm like, when I'm anxious, I breathe harder and faster. If you notice that you're feeling crabby, if you're noticing you feel the right to eat an entire pizza yourself, I mean, whatever the things are, right? Carbs are part of, at least for me, what happens when I'm in a good place. I'm like, okay, let's have some pizza. So for whatever your things are, when you notice that, the idea is that we want you to be able to, move and change faster. So you first got to notice something's wrong in order to change it. So we want to be aware of our own reactions, thoughts, and feelings, body tension, so we can come back into balance. And connect with new awareness. So how do we do this? Now, some of you know these things and know them well. Mindful self-regulation has a whole series of strategies, but I wanted to give you some different ones for today, maybe than you'd heard before. Some of you already do breathing as part of it, right? So we can even do this together to get rid of our Zoom bomber. You can take a deep breath in and stretch it out. Hold your breath. Hold it up for 4. And let it out slowly, right? Deep breath in. And let it out slowly. Now that's something you can do when you're by yourself or in a yoga class or somewhere else. I'm not going to suggest you say to your client, excuse me, I need to take a little moment and do that exercise. But I do want to show you something you can do and no one would ever know you were doing it to get grounded. So what I'd like you to do right now is uncross your legs and move forward in your chair. Move forward far enough that you can feel your heels and your toes, your feet on the floor planted hard. So my friends who are shorter, get all the way up to the front of your chair so you can really push down on your feet. Take your hands and put them on your knees and give them a little rub. And you're going to lean forward and you're going to take a little breath in and out. And you just look like you repositioned yourself, right? You can do that on Zoom. You can do that in person. But that whole part about uncrossing your legs, planting your feet on the floor, pushing your feet into the floor with your hands, and then using that shift in your body, no one would ever know what you were doing other than just shifting to get more comfortable or being more attentive to the conversation. Some people use self-talk. Mine is, I got this, I got this, I got this, even when I don't, to try to get me through to the other side. Some people have a prayer and that's their self-talk, and that's what's meaningful to them. Some people use imagery. It could be a picture that comes to your head of your dog, of a place in nature, of a child, of, whatever. I had a nurse in Oregon who talked about her imagery when things were feeling upset and she was trying to get calmed down, is she'd see herself as a field of wheat and a big gust of wind comes down and pushes the wheat all the way down to the ground. But then as the wind passes, the wheat comes back up and it's in the sun and it's all fine, right? It had a thing that passed through it, but it's still just right there and solid and fine. So on the back of your list of what do you like when you're dysregulated, I want you to write down, what is your go-to MSR strategy going to be? Is it going to be imagery? Is it going to be self-talk? Going to be grounding? Is it going to be breathing? And just write it down. Because the idea is, as soon as you start feeling that headache or that tummy ache, or as soon as you notice yourself getting anxious or irritable, what are you going to do to try to bring yourself back into yourself and take that second to get regulated? So go ahead and write that down so you have it on the listed. And I want to show you a great video because, again, I think this is something you might be able to use with your families that underscores the power of breathing.
I don't like it to say all my things. When I get mad, you can get a headache and it can start hurting. Your brain, because you're like really mad. And you start to get sweaty because you're getting really, really mad. And when you start getting really mad, you turn red. When your body can't really control yourself, mad just takes over your body. I just get out of control. It's kind of like if you had a jar and then the jar would be your brain and then you put glitter in the jar and that would be how you would feel. If you shook up the jar and the glitter went everywhere, that would be how your mind works. And it's like spinning around and then you don't have anything to think. And you sometimes punch stuff from people when you don't really mean it. When I get angry, I feel it in my heart. I really don't like when I get angry. The amygdala really reacts, but the prefrontal cortex tries to.
Hey, Rebecca, we're getting some feedback that the audio is not very clear.
I just like sometimes.
Okay. So maybe what we'll do is stop because you do have this link in the links, and I'll let you watch it on your own so you can really hear it. But it's, I think, a great tool to use with families, use with yourself, that just kind of underscores the power of breathing and doing this with kids, with each other, with your partner, with the other parent or other caregivers in your life and in your home. So sorry, the audio wasn't. And I guess I just want to talk a little bit about what we've learned in terms of mindfulness and folks who are doing work with the littles. This was a study that was done with Pennsylvania Head Start staff. It's a big study, over 2,000 people were in it, and they were looking at adverse childhood exposures in the staff themselves, right? So we know that ACEs are prevalent. We'll talk more about it tomorrow. If you're not as familiar, don't worry, you'll learn more. But the idea was that this researcher, which I thought was really interesting, wanted to look not at just kids, because he's a pediatrician, he wanted to look at the caregivers themselves. So here's why he did the study. As a pediatrician, one of the first things I noticed when I spent time with Head Start teachers is that many of them looked really weary. And I know that many of you are case managers and doing other kinds of things, but I think this universal experience of working with families and little people or parents is something that, you know, cuts across nursing and all other kinds of healthcare. When teachers, parents, and I would say healthcare providers are worried, tired, stressed, preoccupied, they're not at their best, and most of them know it. I felt it was important to understand how the teachers were doing. That included asking them about childhood trauma, because we know it can be positive, affect health, functioning, and be reactivated in the workplace. So let's talk about what he found. Right, no surprise, 25% reported 3 or more difficulties from their childhood. 30% reported having 3 or more of the 7 stress-related health conditions. These are health conditions that you can change, right? So obesity, asthma, depression, diabetes, high blood pressure, headaches, and back pain are all things that we have a little more control over. And we're interested in sort of the interplay between these childhood histories of trauma and how it can affect us moving forward, and then what helps. That's the thing that I'm most interested in. So that's why this third bullet is so important. Among the participants with the highest level of mindfulness, even if they had a lot of bad things happen to them in childhood, the risk of having multiple health conditions was 50% lower compared to those with the lowest levels, even for those who had many ACEs. So meaning, if you had a lot of trauma in your history, but you had a lot of mindfulness, your health was pretty good. But if you didn't have much mindfulness and you even had a low ACE score, your health was more likely to be impacted. So that has huge implications for the field, because what it means is we want to take care of thinking about how do we integrate organizational changes, more mindfulness, more consciousness around bringing in reflective practice as part of what you're doing in your programs. So we found that with those greater levels of mindfulness, the staff had less depression, they slept better, they took less mental health days, there was less smoking, binge drinking, and binge eating. And here's an example of the scale that they use to measure this. So this is something that you can, again, it's in the list of tools that you have from Kelsey. These are the kinds of questions they use to score the scale, because these are things that we can work on and change. So it's exciting. So drilling down from that over 2,000 people that were part of this original study, what they found is that those staff who reported more mindfulness had a stronger working alliance with parents, had higher levels of mutual trust and shared goals for home visiting. And this relationship has been identified as a key factor that can influence the quality and outcomes of home visiting services. And I would say any perinatal case management services. So this idea that greater mindfulness allows you to connect more, put your cape away more often, recalculate faster if you're out of a tune, catch your own breath so that you can be present with the other person's sadness, is all connected to this. So I'm recognizing that we are about 10 minutes out. So I'm trying to decide what I want to do here, because we've got a little derailed. So let's think about this. I think I will go ahead and share this with you. A little case study. Oops. So Michelle has just heard from her client. Sometimes, like I'm on a roller coaster with Ben, I never know what's going to happen next. It's worse on Friday nights. He's always mad at me. I don't know. I just feel so tired right now, and him blowing it up at me makes me feel anxious all the time. Now, Michelle's backstory. So she's a home visitor, case manager person working in maternal health. Her backstory is this. This is the second time Michelle has heard about a complicated relationship story with her families today. Also, Michelle's sister is with a partner who's not nice to her, and Michelle has been worried. Similarly, things are worse for her sister Friday nights with him, as there's drinking and partying that happens then. What are your thoughts about Michelle in this moment? What do you think is going on for Michelle? And I don't want you to think about the client. I really just want you to think about Michelle. What do you think is going on for her? I mean, chances are she's feeling overwhelmed, right? She's getting it both from her clients, feels overwhelmed and triggered. She feels the weight. Beautiful. Yes. She's feeling heavy. And like, you know what? It's in her personal life. It's in her professional life. What do you think she needs to do? How can she take care of herself? How can we apply what we learned today? What would you do if you were her buddy? She feels uneasy and overwhelmed. Sounds like she's feeling a big triggered. Yeah, she is. So what kinds of things do we think we could do to help? Ask her how she's feeling, listening to her, Sandra. I love that you used all caps. Good. Ask how she's feeling. You're going to notice it. You're not going to let it pass, right? You're going to offer like, hey, you know, I've got a little bit of time. You want to talk about it? You know, you're going to think about how you can do that. I just want to check in with you because you just shared a lot with me. It's both your clients and I know what's going on with your sister. I just want to check in, like, is there anything I can do? I'm thinking about you. You know, what kinds of things are you doing to take care of yourself? Let's talk. Nice. And then here, you know, I think as we're thinking about Michelle, you know, one of the things that I can imagine, I shared the story earlier with my sister, is that sometimes we have to repair with ourselves when we first make mistakes. So let's say Michelle feels like I didn't handle that very well with the client. I pulled out my cape. You know, part of how we create these communities and these organizations where trauma is thought through and healing-centered engagement is held up is that we notice, are we able to forgive ourselves, right? So self-compassion is when compassion is directed inward, being touched by your own suffering, generating with the desire to activate your own suffering and treating ourselves with understanding, kindness, and concern. And that's something that, again, we don't necessarily make time for, but I know some of you say this to your friends, like, I hope you're not beating yourself up about this. Going back to that mantra we talked about before, that you're worthy in this moment. You did the best you could. We're going to recalculate and figure this out together, right? So yeah, if you make a mistake, you know, certainly you're going to say, okay, that was a messed up. That first arrow comes, but the real question is, are you going to double down with that second arrow and say, oh my God, I'm worthless. I shouldn't be doing this job. I'm not good at what I do. All of the things, right? Are we able to avoid the second arrow in what we're doing as part of self-care and as part of talking about this? Because I think that a lot of us who are helpers, if we mess up, I think we take it to heart. And so our systems, you know, reminding us that, hey, okay, we're all going to make mistakes, but the question is, are you going to double down and beat yourself up after you've acknowledged the mistake and we try to rectify it, make it right? So we're not able to attune to other people when we're beating ourselves up, right? And when we're beating ourselves up, we're both the attacker and the attacked. And so the more that we can be aware, and this is all part of being present, that mindfulness about, am I able to think I'm worthy, love myself in this moment and not beat myself up, is the other part of being present. So one of the things that we believe is that, you know, for supervisors, they certainly deserve tools and supports specific to reflective practice, specific to working with you, and they may not know about them. So if you're a frontline person and you're like, wow, my supervisor could benefit from this, you might want to share it with them. I'm not going to spend much time on it because we lost some time with our Zoom bomber. But I do want to say that if you're interested in the fan and you're a supervisor, there's a whole training for you on how to support your staff. And what's cool about it is that it has tools that allow you to remember to take off your cape and be present with the person in front of you, right? So how's it been like for you in your work since we last talked? So in the beginning, you're going to make sure that you're all grounded and centered before you even have that conversation. Finding an agenda together, not deciding on it for the other person. What would you like for us to focus on? Here are some things we might talk about. Where should we start, or what do you want to start with? Near the middle, we want to make sure that we're really getting to the core of what people want. And again, this is something we can use with not only staff, but also with families. And then checking in with yourself after the visit. How am I now? Should you be going into another reflective supervision practice with somebody, or should you be going out and doing a drive-through in Starbucks and getting yourself a coffee and kind of giving yourself a little 10-minute break before you go in so that you can be really present with the next person? So again, these are sort of more data points on people who are trained in the FAN. We know that supervisors are, when they're FAN trained, are able to stay regulated in difficult interactions, which is really important. They ask more questions versus telling you. And isn't that a key to all good relationships, asking more questions as opposed to being told? They talk less and listen more. They are seen by their staff as more able to build staff's capacity, so staff feel like it's a benefit, and they report satisfaction and confidence. So I'm going to take this last minute and do one last thing with you, and that is this. I'm going to ask you to think about someone in your life who's alive, who you've never fully thanked. Right? Take a moment to close your eyes and think about a person who made an enormous difference in your life, who you never properly thanked. Who is that person? And see their face in your mind's eye. I mentioned this person needs to be alive, and you can do this on a piece of paper, or you can do this on your phone, but just write a thank you. Just spend a few minutes. Write a testimonial on the paper about how this person impacted your life. And I'm just going to give you a couple minutes to do that. And then we're going to head toward closing out the day. So just a couple minutes. Who's the person, and what did they do to make a difference in your life? I'm going to let you finish the sentence you're working on, and then we're going to stop. And you can keep adding after the webinar. One of the questions I ask when I do this exercise is, if you were to send what you just wrote or texted to the person, do you think they would benefit more or you benefit more? And the answer is you benefit more, because this gratitude fills you up. When you are in gratitude, appreciating and noticing, while it's wonderful for them to get it too, it actually helps you. So thinking about a gratitude journal, using gratitude as part of what you're doing with your colleagues. So my friends who are independent contractors, thinking about a gratitude exercise when you're getting together on that Friday afternoon for coffee. I think these are all things that really can help build the strongest practices for all of us. So what I would like you to do, last exercise, and you can just take 1 minute, write down one thing you're going to do between now and tomorrow to take care of yourself. One thing, just one thing. You can take a 90-minute break. Are you going to do a 2-minute call where you listen and get listened to? Are you going to write compliments or finish your gratitude letter? Just write down what you're going to do. You can just quick note, because I'm going to ask you tomorrow if you did it when we come back together again. So one thing that stands out for you about today's training and what you're going to do, how you're going to apply it to yourself. If you're interested in more training on the fan, this is how you get that information. And again, it's on the list of resources that Kelsey's sent out to you. And I just want to do a quick recap. We went on a journey today, right? So we talked about the power of 5 minutes every 90 minutes, taking a break. We talked about the Starbucks drive-through and carving out some alone time for yourself to be present. We talked about huddles and reflective practice. We talked about scuba buddies, diving buddies, so that we can have someone that we're paying attention to and is paying attention to us as a way to help us pay more attention to ourselves, actually. The power of writing messages to each other and to our clients. And then, of course, gratitude. So here's additional resources on support. And we're just going to do one more mindful movement together. So I'd like you to wrap your arms around yourself, put your left hand over your right arm and rub your arm. Give yourself a squeeze. Do the same thing on the other side. Rub your arm. Stretch your hands in the air. Wiggle your fingers, shake out your hands. We're going to come back to center. And we're going to finish here. I love this quote. Compassion is not a relationship between the healer and the wounded. It's a relationship between equals. Put down your cape. Only when we know our own darkness well can we be present with the darkness of others. Compassion becomes real when we recognize our shared humanity, which is what I know you do with your families, your moms, your birthing people every single day. So I say the deepest thank you for joining us today, for recovering from a Zoom bomber with us. And I really look forward to tomorrow, and hopefully we'll be able to set it up so we aren't Zoom bombed again. But you know what? We survived it. We survived it together. So again, I just want to thank you all, and I'm looking forward to tomorrow.